Hi, this is Jacie, and today I want to talk with you a little bit about lisps. Lisps happen most often on an S and Z sound, but they can also happen on the SH, the CH, the J, and the J sound. This is when the tongue is just not quite in the right place for these sounds. I'm going to talk with you about the S and Z because those are two of the most common sounds that we see it on. The S and Z should sound very crisp, S or Z. The tongue isn't quite against the front teeth, it's behind them slightly, and the air comes out the middle of your mouth instead of out the sides or anywhere else. There are 4 types of lisp. The first one is the interdental, which is one we see most often in speech therapy, or you might see on TV or with people. It's when the tongue comes out of between the teeth instead of the correct placement behind the teeth slightly. This would sound like instead of sun, you'd have fun, or instead of bus, you'd have buth. The second type is the dentalized, which is where it pushes against the teeth, but it doesn't quite come out between them where you can see it. So instead of sun, you might have fun, or instead of bus, you might have bus. And it just doesn't sound quite as crisp. The third type is the lateral lisp, and this is I've seen quite a bit in therapy as well. It's when the S sounds mushy. So instead of sun, you might have shun, or instead of bus, you might bush. The air comes out the side of the side of your tongue instead of out the front. The last lisp is called the Pallet Tool, and it's one that is not very common. I don't think I've seen it in my years of therapy, but it is there sometimes, and it's when the back of your tongue tries to make the S sound with the top back of your mouth. So instead of sun, it would sound hun, or instead of bus, it would bach. So it's back there. I want to talk with you about these because you might hear this sometime. If you hear an S or Z or the other sounds I mentioned and they just don't sound quite right, listen and see if it might be one of these.